Today's our topic is pneumothorax. First, we will discuss definition. Then, what are the different types of pneumothorax? Then, what are the signs and symptoms of pneumothorax? Then, diagnosis. Then, we will see what is the treatment of pneumothorax, and at the end, we will discuss some clinical scenarios related to pneumothorax. But before all this discussion, I want you to know about what is pleural space or pleural cavity. For understanding of pleural space or pleural cavity, I am making a functional diagram to understand this pleural space or pleural cavity. I am making here is trachea, and you know these are all tracheal rings. Here is a manubrium sterni, sternum, and xiphoid process. First rib, it's moved backward. Second rib, third, fourth, fifth, sixth. Actually, 6 and 7 ribs are fused together. And you know, first 7 ribs are true ribs because they directly attach to sternum, but 8, 9, and 10 are false ribs because they are not directly attached to sternum. Intercostal muscles are present. Okay. These are ribs and intercostal muscles are present between ribs. Behind these ribs are present lungs. On this side, I am removing these intercostal muscles and ribs and making only cross sections of ribs and lung. Here is the first cross section, second, third, fourth, fifth, sixth, seventh, and here cut edge of present diaphragm. ribs present, intercostal muscles are present between them. Now, I am taking a small piece from this and making it enlarge. Again, this cross section of rib here, intercostal muscles, surface of lung here, where is exactly pleural space or pleural cavity is located. It is located between two membranes. One membrane which is called parietal pleura, which lines the ribs and intercostal muscles and chest wall. Other layer of pleural cavity, this is called visceral pleura. Visceral pleura lines the surface of lung, and also it deepens into the fissures which are present on lungs. So, between these two layers, parietal pleura and visceral pleura, this space exactly called pleural space or pleural cavity. Normally, this space contains only 10 to 20 ml of serous fluid. And also, serous fluid color is transparent. Another term which I want you to know is atelectasis or collapsed lung. What is meant by atelectasis or collapsed lung? When in this space, pleural space or pleural cavity, air or fluid or blood accumulates in this space and exert pressure on surface of lung. Normally, the pressure inside the lung is greater than the pressure inside the pleural space or cavity. But when air, fluid or blood accumulates in this space, pleural space or pleural cavity, it the pressure in this space increase the pressure than the pressure inside the lung, and ultimately lungs shrink. This is actually called atelectasis or collapsed lung. After this discussion, you know what is pleural space or pleural cavity, what is meant by atelectasis or collapsed lung. We start discussing pneumothorax. So what is pneumothorax? Pneumothorax is air in pleural space or cavity is called pneumothorax. So what are the different types of pneumothorax? First, primary spontaneous pneumothorax, secondary spontaneous pneumothorax, traumatic pneumothorax, and at the end, tension pneumothorax. So what is primary spontaneous pneumothorax? Primary spontaneous pneumothorax occurs when air accumulates in this space, pleural space or pleural cavity, without underlying pulmonary disease. Air accumulates in pleural space or pleural cavity, but there is no pleural pulmonary disease. Then we will call it primary spontaneous pneumothorax. So what is the difference between primary spontaneous pneumothorax and secondary spontaneous pneumothorax? So secondary spontaneous pneumothorax. In secondary spontaneous pneumothorax, underlying pulmonary disease present. What is the difference between primary spontaneous pneumothorax and secondary spontaneous pneumothorax? In secondary spontaneous pneumothorax, underlying pulmonary disease is present, but in primary spontaneous pneumothorax, there is no underlying disease. Another difference between primary spontaneous pneumothorax and secondary spontaneous pneumothorax, it is most common. Most common pneumothorax is primary spontaneous pneumothorax. There is no underlying pulmonary disease, and in young adults is most common. Next, secondary spontaneous pneumothorax. It is related to underlying pulmonary disease. Most commonly COPD. Other underlying diseases are also predisposed to secondary spontaneous pneumothorax, but most common predisposing factor of secondary spontaneous pneumothorax underlying pulmonary disease which is present COPD. About 70% cases which reported secondary spontaneous pneumothorax are related to COPD. Other underlying diseases which are related to secondary spontaneous pneumothorax are TB, asthma, cystic fibrosis. Next, traumatic pneumothorax. Traumatic pneumothorax, a blunt trauma or gunshot wound can lead to pneumothorax, can lead to air in the pleural space or pleural cavity. Next is the tension pneumothorax. These three types, primary spontaneous pneumothorax, secondary spontaneous pneumothorax, and traumatic, we can call them simple pneumothorax. Primary spontaneous pneumothorax, secondary spontaneous pneumothorax, traumatic pneumothorax. We can call them simple pneumothorax. And tension pneumothorax. So tension pneumothorax is different from these. Tension pneumothorax develops when one-way wall develop. What is one-way wall? One-way wall means when due to trauma or another cause, air enters in this space or pleural cavity, but cannot go out. Basic difference between simple pneumothorax and tension pneumothorax is that tension pneumothorax continuously expand. What is the difference between simple pneumothorax and tension pneumothorax? That in tension pneumothorax, the area involved it continuously expand due to this one-way wall mechanism. Air enter in pleural space but cannot go out. So with more and more air, more and more area involved, and leads to atelectasis. We have already discussed collapsed lung atelectasis. More and more air enter in this space and leads to atelectasis, collapsed lung, but cannot go out air. So difference between simple pneumothorax and tension pneumothorax, it continuously expand tension pneumothorax. Other differences which are present in tension pneumothorax and not present in simple pneumothorax. Tension pneumothorax is related to hypotension. And tracheal deviation. Although tracheal deviation is a late sign of tension pneumothorax. So what is the difference between simple pneumothorax and tension pneumothorax? Tension pneumothorax, one difference is that it continuously expand due to one-way wall mechanism. Other, it is related to hypotension and tracheal deviation. Next, what are the signs and symptoms of pneumothorax? Commonly, it is related to sharp pain, shortness of breath, tachycardia, tachypnea. But again, remember the differences between simple pneumothorax and tension pneumothorax. These all signs can be present in simple pneumothorax and tension pneumothorax, but tension pneumothorax, other signs, hypertension and tracheal deviation also present. Next, diagnosis. A simple chest radiograph, chest X-ray can tell about pneumothorax. But remember, chest X-ray can demonstrate pneumothorax, but the gold standard method, most commonly asked in scenarios related to pneumothorax, the gold standard method which is used for diagnosis of pneumothorax is CT scan, CT chest, computed tomography. CT test is gold standard method test for pneumothorax. Next, what is treatment? small spontaneous pneumothorax uh, cannot require any intervention or treatment. Just monitoring is enough for small spontaneous pneumothorax. But large pneumothorax, spontaneous or traumatic, they require intervention. But remember, less than 30% area when involved. It requires hospital admission and also intervention. So small spontaneous pneumothorax not required any intervention or other modality. They only require a monitoring. But large spontaneous pneumothorax and involving less than 30% area, when involved, then hospital admission is mandatory and intervention is required. And remember, tension pneumothorax is a medical emergency and required immediate intervention. Because if tension pneumothorax remains unattended, patient can die. It can lead to death of the patient. Next, clinical scenarios. Before proceed to clinical scenarios, I'm discussing some points and highlighting some points. First point is there primary spontaneous pneumothorax. The type of pneumothorax is most common in young adults and also most common pneumothorax, and it's not related to any underlying pulmonary disease. Secondary pneumothorax is related to underlying disease. Tension pneumothorax, tracheal deviation, different signs and symptoms are present in tension pneumothorax and simple, but the difference between simple pneumothorax and tension pneumothorax is related to hypotension and also tracheal deviation. Tracheal deviation is late sign but is present only in tension pneumothorax, not in simple pneumothorax. Other clinical scenarios which you can encounter in your exams or other chip, that is in diagnosis, the gold standard method for diagnosis of pneumothorax is CT chest, computer tomography. Chest X-ray is can also demonstrate pneumothorax, but it's not gold standard. Okay, it's all about pneumothorax. Now we will discuss some clinical scenarios, and you see how you well understood this topic. We are discussing some clinical scenarios. For your better appreciation of this topic, how well you understood this topic, and simple points. First scenario: a patient admitted in hospital with chest trauma. Left side. Experiencing extreme dyspnea, tachycardia, tachypnea, and also there is unequal rise and fall of chest on left side. A patient admitted in hospital with chest trauma, left side, experiencing extreme dyspnea, tachycardia, tachypnea, and also there is unequal rise and fall of chest on left side. What is your suspicion? Open pneumothorax, closed pneumothorax, tension pneumothorax, or primary spontaneous pneumothorax. So here is a scenario: a patient admitted in hospital with chest trauma left side, experiencing extreme dyspnea, tachycardia, tachypnea, and also there is unequal rise and fall of chest on left side. What is your suspicion? Either is the open pneumothorax, closed pneumothorax, tension pneumothorax, or primary spontaneous pneumothorax. Here is one point which you can focus on, that you can have extreme dyspnea, tachycardia, tachypnea in all these: open pneumothorax, either closed pneumothorax, tension pneumothorax, or primary spontaneous pneumothorax. But one point which is this one. Unequal rise and fall of chest on left side. You know, in primary spontaneous pneumothorax, most cases are mild. So there is less likely chance of having rise and fall unequal on left side. Next, in all these tension pneumothorax, closed pneumothorax, and open pneumothorax, maybe you are thinking that maybe it is tension pneumothorax. But focus on this point, you can have answer. Unequal rise and fall of chest on left side. Remember, in tension pneumothorax, there is development of one-way valve. That is, air can enter in pleural space and cavity and can lead to collapsed lung or atelectatic lung, but air cannot go out of this space. But here you are finding that rise and fall. Next scenario. What is incorrect about primary spontaneous pneumothorax? What is incorrect about primary spontaneous pneumothorax? First, most common in young adults. B option is related to underlying causes like TB, asthma, or COPD. C option is related to smoking. So here is a primary spontaneous pneumothorax. Question is what is incorrect about primary spontaneous pneumothorax? Either is the most common in young adults, either is related to underlying causes like TB, asthma, COPD, either is related to smoking. You tell me answer. Next question, third. Which type of pneumothorax is related to hypertension and tracheal deviation? So primary spontaneous pneumothorax, tension pneumothorax, open pneumothorax, or closed pneumothorax. Which type of pneumothorax is related to hypotension and tracheal deviation? Either is a primary spontaneous pneumothorax, tension pneumothorax, or open pneumothorax, closed pneumothorax. These are three scenarios. If you can pick correct answers of all of these three scenarios, you can very well perform in your exam. And if you find difficult for answer for these three scenarios, you can go back to watch again the previous video about all the pneumothorax, and I hope you can have your answer. So this is all about pneumothorax. Tell me answers, correct answers of these scenarios in comment section, and